Good evening, ladies and gentlemen. As the day draws to a close, we gather here not just to reflect, but to be inspired, enlightened, and reminded of the power of vision and knowledge. As each moment unfolds, we are given a chance to leave footprint on the sands of time. Indeed, today, we have come together to celebrate a landmark event of the year, the first Dr. H. Sudarshan Ballal Oration 2024. It is my privilege to welcome you all to the inauguration of the first ever oration, an event that celebrates the remarkable legacy in healthcare and leadership. Dr. H. Sudarshan Ballal is a name that resonates far beyond the corridors of medicine. His journey as a clinician, leader, and mentor has left an indelible mark on the countless lives and has set a gold standard in compassionate care and innovation. This evening, we celebrate that remarkable legacy by establishing a platform to inspire ideas that drives transformation and progress. Dr. Ballal sir is a pioneer in the field of healthcare and a source of inspiration to many of us. We are privileged to have you here, sir, for this oration. It's an honor to us. So as the evening unfolds, let us open our minds, immerse ourselves in this enriching experience, and celebrate an evening dedicated to knowledge, leadership, and boundless potential of the human spirit. On behalf of the organizing team, I extend a hearty welcome to all our distinguished guests, our faculty members, who have readily accepted our invite to be with us today. We call upon each one of you today to immerse yourself in this scientific extravaganza that we have strived to deliver today with gusto. Thank you. As we begin this momentous occasion, I would like to invite our esteemed nephrologist team to guide our distinguished guests to the dais for the formal inauguration. I would like to invite our distinguished guests and dignitaries to join us on the stage for the formal inauguration. I request our beloved Chairman Sir, Dr. H. Sudarshan Ballal, MHEPL, and our beloved speaker of the evening, Professor Vivekanand Jha, Executive Director, the George Institute for Global Health, India. May I kindly invite you both to the dais. Thank you, sirs. I request Dr. H. S. Ballal, Pro-Chancellor MAHE Manipal, and our distinguished chief guest, Lieutenant General Dr. M. D. Venkatesh, Vice Chancellor MAHE, please join us on the stage, sir. Thank you, sirs. I request Sagir Siddiqui, Regional Chief Operating Officer, KMC Hospital Mangalore, please join us on the stage, sir. Thank you. Please be seated, sir. Respected dignitaries, esteemed faculty, honorable delegates, well-wishers, ladies and gentlemen, a hearty welcome to all of you to this highly anticipated program of the year, the first Dr. H. Sudarshan Ballal Oration 2024. Indeed, today the stars have aligned perfectly over our beloved city of Mangaluru, or Kudla as it is fondly called, as we celebrate this pivotal occasion today, this calendar year. It is in order that we offer gratitude to the Almighty for His boundless blessings bestowed upon us. In the words of a late father of the nation, Mahatma Gandhi, prayer is the key of the morning and the bolt of the evening. Let us fold our hands and reverently bow down to the Almighty and invoke His blessings upon us on this august occasion. Mr. Pratham will lead us in prayer. I request everyone to rise.
मधुरं वदनं मधुरं नयनं मधुरं मसितं मधुरं हृदयं मधुरं गमनं मधुरं मधुराधिपतेरखिलं मधुरम् वचनं मधुरं चरितं मधुरं वसनं मधुरं वलितं मधुरं चरितं मधुरं भ्रमितं मधुरं मधुराधिपतेरखिलं मधुरम् पानी मधुरो पादौ मधुरं नृत्यं मधुरं सत्यं मधुरं मधुराधिपतेरखिलं मधुरम् गीतं मधुरं पीतं मधुरं भुक्तं मधुरं सूक्तं मधुरं रूपं मधुरं तिलकं मधुरं मधुराधिपतेरखिलं मधुरम् मधुरं मोक्तं मधुरं दृष्टं मधुरं सृष्टं मधुरं मधुराधिपतेरखिलं मधुरम् मधुरं फलितं मधुरं मधुराधिपतेरखिलं मधुरम् मधुराधिपतेरखिलं मधुरम्
Please be seated. Thank you, Pratham, for the exquisite rendition of the beautiful devotional song. Unisa, please come over to the dais, please. In the words of the poet Annie Flint, we are the God's little lamps to shine where he shall say, and the lamps are not for the sunny rooms and not for the light of the day, but for the darkest places of the earth. I request our most esteemed dignitaries to light the lamp and inaugurate today's program.
सम्पदः शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः शत्रुबुद्धिविनाशाय दीपज्योतिर्नमोऽस्तु ते दीपज्योतिर्नमोऽस्तु ते दीपज्योतिः परब्रह्म दीपज्योतिर्जनार्दनः दीपज्योतिः परब्रह्म दीपज्योतिर्जनार्दनः दीपो हरतु मे पापम् सन्ध्यादीपनमोऽस्तु ते ओ दीपब्रह्मरूपस्त्वं ज्योतिषां प्रभुरव्ययः ओ दीपब्रह्मरूपस्त्वं ज्योतिषां प्रभुरव्ययः आरोग्यं देहि पुत्रांश्च मतिं स्वच्छां हि मे सदा रवेरस्तं समारभ्य यावत् सूर्योदयो भवेत् रवेरस्तं समारभ्य यावत् सूर्योदयो भवेत् यस्य तिष्ठे गृहे दीपः तस्य नास्ति दरिद्रता शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः शत्रुबुद्धिविनाशाय दीपज्योतिर्नमोऽस्तु ते दीपज्योतिर्नमोऽस्तु ते शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः शुभं कुरुत्वं कल्याणम्
Thank you, sirs.
धनसम्पदः
The start of something new brings the hope of something great, and suddenly anything is possible. I call upon Dr. Mayoor V Prabhu, Professor and Head, Department of Nephrology, KMC Hospital, to welcome this august gathering.
Good evening, ladies and gentlemen. I deem it a very proud privilege and honor to welcome one and all to this inaugural edition of the Dr. Sudarshan Ballal Oration. At the outset, let me please apologize first in case my welcome address sounds like a vote of thanks, because my heart is actually filled with gratitude seeing the response everyone has given to our invitation to be part of our happiness as we launch our department's first oration. Indeed, a red letter day in the history of our department, and what an occasion it is. So I thank all of you for being here to be part of our happiness. Let me begin by welcoming to this august gathering the honoree of today's oration, Dr. H. Sudarshan Ballal, Chairman, MHEPL, and Professor Vivekanand Jha, Executive Director of the George Institute, India, who is our orator today. We are indeed fortunate to have two stalwarts, two living legends in the field of nephrology present among us today for the very first edition of this oration. Both Dr. Sudarshan Ballal and Dr. Vivekanand Jha charted different paths subsequently after they gained immense recognition and laurels to their names as clinicians and teachers. Dr. Ballal scaled the heights of the administrative and corporate world and is now chairman of MHEPL, which is, it's a proud matter for us that we are today India's largest corporate hospital chain. Dr. Vivekanand Jha went on from clinical nephrology and teaching at PGI Chandigarh to become the executive director of George Institute, India, and the past president of International Society of Nephrology, the first Indian to become president of ISN. the impact of his projects as we speak is going on in 20 plus countries. For me, personally, it's a matter of happiness that Professor Jha is among us today, because once 10 years ago I had tried to invite him for an event which unfortunately didn't work out, and after that I've been trying for 10 years. And finally he's here with us today. Thank you, sir. Thank you so much. It's indeed a matter of great pride for us. Welcome, sir. We in the Department of Nephrology, we are, and KMC Mangalore, we are indeed proud that Dr. Sudarshan Ballal, a blue ribbon distinguished alumnus of KMC, is today back to his alma mater to be recognized with an oration in his name. An oration which will last as long as our department and our college lasts. And we have none other than Dr. Vivekanand Jha to deliver the inaugural lecture. So I would not like to delve too much on the accomplishments and the legacies of both of them, as that particular duty we have allocated to their proud students. So I will just end it by saying that as teachers, both Dr. Sudarshan Ballal and Dr. Vivekanand Jha have influenced this district through their students, Dr. Sushanth Kumar and Dr. Ashok Bhatt. Dr. Sudarshan Ballal started Karnataka State's first DNB nephrology training program, and it's a matter of pride for us that his first DNB student pass out is Dr. Sushanth Kumar, who is here among us. Similarly, Dr. Vivekanand Jha, in his wide and long career as a teacher at PGI Chandigarh, has trained hundreds of nephrologists who have made an impact throughout the world. And one among them is my senior colleague, Dr. Ashok Bhatt, who will be introducing his teacher. And through their students, they have touched the lives of thousands of patients in this district over the past 2 to 2.5 decades. So I think that is the only legacy I will talk about. I think I will leave it to the proud students to introduce their proud teachers subsequently. It is an honor to welcome our beloved Pro-Chancellor, Dr. H. Ballal, to this August gathering. Sir, I must add that we do not consider you as being from Manipal. We consider you as being part of KMC Mangalore and our representative in Manipal. And therefore, I don't think it's right for me to welcome Dr. H.S. Ballal to a home event, and that too to a family event. So only we can assure you that we will make sure that you keep visiting our campus by conducting programs again and again. Welcome, sir. We are deeply honored by the presence of Madam Indira Ballal today. Welcome, Madam. And I think since you are here, I think with Sir's permission, I should disclose a story. So it was in 2017 where at the Indian Society of Nephrology Annual Congress in Delhi, and Dr. H.S. Ballal was our chief guest. So it was a matter of pride for all of us from KMC Mangalore and KMC Manipal. Many of us were there. And so at the inaugural, we were all present right on time. And the inaugural started and went on. And when the time came for the presidential address, the chief guest address, I still remember the first thing Sir said was, I wish my wife was present here today, so that she hears so much praise and she feels that her husband is somebody big. Welcome, ma'am. Sir, even I am following your policy now. Thank you. Yes, sir. Yes. We warmly welcome our Honorable Vice Chancellor, Lieutenant General Dr. M Venkatesh, to this event. Welcome, sir. So we are indeed indebted to you for graciously accepting our invitation in spite of several pressing commitments which you had around the same time. We acknowledge that, sir, and we are very, very proud to have you with us here today. Sir always says that the Mangalore campus has a special place in his heart, and he almost never refuses an invitation to come here. And we are quite happy that this time he is here because in our last event, both our VC sir and Sharath sir had missed. And therefore, we were very particular this time that he should be here with us. Welcome, sir. Thank you once again for being here. The theme of today's oration is about research and clinical care not being mutually exclusive, but being two sides of the same coin. So on that line, I must add that this cannot be better illustrated than by the example of the guests of honor we have among us today. All stalwart clinicians who are now at the pinnacle of their administrative careers as well. And we are very proud to have all of them with us. Dr. Sharath Rao, our Pro Vice Chancellor, Faculty of Health Sciences. Welcome, sir. He is a renowned orthopedic surgeon who, while leading the next phase of the growth of MAHE with his very important portfolio, has also managed to continue exercising his clinical and surgical skills. So I'm told, sir, still runs a full OT and even outreach clinics. And therefore, that's quite inspirational for all of us. It's a matter of great pride for us that he is here. Welcome, sir. I was told that recently the Department of Orthopedics at KASTURBA Hospital in Manipal was rated as one of the best in the country by the Week survey. So that is in something in no means your contribution is there, sir. We have with us Dr. M Vijayakumar, Honorable Vice Chancellor, Yenepoya deemed to be University. Welcome, sir. He is an oncosurgeon of great repute whose surgical skills and clinical acumen is still widely respected. He has formerly been the director of a very prestigious institute, Kidwai Institute of Oncology, which is an institution of national and international repute. He is, while leading the expansion of Yenepoya University as an administrator, he continues to be a very active surgeon till date, handling the most complex and difficult cases. Welcome, sir. It is an honor to welcome to our gathering campus head, Pro Vice Chancellor, Mangalore campus, Dr. Dilip G Naik. Welcome, sir. Sir is a periodontist by profession who has gained immense repute in his field before subsequently scaling the administrative ladder as Dean of MCORDS and subsequently as the Pro Vice Chancellor, Mangalore campus. He has been ever encouraging and approachable, supportive to all of his faculty, and we appreciate your presence here, sir. Welcome, sir. I welcome the ever affable and most unassuming Dean KMC Manipal, Dr. Padmaraj Hegde. Welcome, sir. He also exemplifies the theme of today's oration. He is one of the most sought-after urologists in the district, apart from being the dean of one of India's most reputed medical colleges. Welcome, sir. I welcome our dean, Dr. B. Krishnan. Welcome, sir. Sir himself is a very prolific researcher, as recognized by Stanford University recently as one of the top 2% cited researchers. Apart from his demanding job as the Dean of KMC Mangalore. Your constant encouragement to all of us to keep conducting more and more events on the occasion of KMC completing 70 years and the MAHE's year of research has culminated in this event. Welcome, sir. Mr. Sagir Siddiqui, the ever popular regional COO, KMC Hospital at Ambedkar Circle. Welcome, sir. So he gave us both a red carpet and a blank check to conduct today's program. So in no less means the success of today's event goes to you, sir. Welcome. It's my pleasure to welcome our Associate Deans of KMC Mangalore, Dr. Shri Kalabaliga, Dr. Suresh Kumar Shetty and Dr. Sheet Lulal to this event. Welcome. Our sister institution, MCords Mangalore, is represented by Dr. Ashita Upur, Dean. Welcome, ma'am. Along with their associate deans, Dr. Junaid Ahmad and Dr. Ati Rao. Welcome. All our affiliated hospitals are well represented at today's event. I warmly welcome Dr. Chakrapani M, Medical Superintendent, KMC Hospital, Attawar, Deputy Medical Superintendent, Dr. Deepak Madi, Dr. Shivanand Prabhu from Durga Sanjeevani Manipal Hospital, Katil, Dr. Avinash Shetty from Kasturba Hospital, Manipal, Dr. Kirtinath Ballal from TMA Hospital, Karkala. I warmly welcome all head of departments, faculties and staff of KMC Mangalore, MCords Mangalore, all consultants and associate consultants of KMC Hospital, Ambedkar Circle and KMC Hospital, Attawar, consultants from various hospitals across the city and beyond. Dr. Ballal sir's colleagues from Manipal Institute of Nephrology and Urology, Bangalore, have traveled all the way to be part of this inaugural edition of the oration. I warmly welcome Dr. Sanjay Rampure and Dr. Shilpa Shetty to this event. It is a matter of pride for KMC Mangalore that our very distinguished alumnus, Dr. Shankaran Sundar, Director of Transplant Services at Aster Hospitals, Bangalore, is here among us. Welcome, sir. We have representation from various organizations and fraternities here with us today. IMA Dakshina Kannada District, API, Association of Physicians of India, Dakshina Kannada District, Ayush Federation of Dakshina Kannada District, etc. I welcome all of you. A warm welcome to all the large number of nephrologists from across the city and beyond. I think today is not a good day to develop any kidney problem because all the nephrologists and urologists of the city are here. Welcome to all of you. Thank you very much for honoring our invite and being here. A cordial welcome to our special invitee, Mrs. Kavita Lakshman Prabhu. Welcome, madam. And Dr. Lakshman Prabhu's daughter, Kritika Prabhu, is also here. Welcome. We welcome all the administrative staff from KMC Mangalore, KMC Hospital, Ambedkar Circle, and KMC Hospital, Attawar, operations, marketing, and other teams who are here with us. All the dialysis staff from all our 3 hospitals and the laboratory staff from all our hospitals, welcome. I welcome the members of the print and electronic media, our beloved students, and all other present here. A warm welcome to one and all, and we hope you enjoy this oration. If I have omitted any names, it is purely by oversight, and I apologize for the same. Once again, welcome all of you to this event. Welcome.
Thank you, Mayoor sir. May I request our organizing team to kindly assist and guide the dignitaries of the dais. Thank you all for your gracious presence. In the words of Eleanor Roosevelt, the future belongs to those who believe in the beauty of their dreams. We have with us today a very distinguished and a much beloved leader who inspires us all to strive towards a higher goal and vision. Dear sir, today we are here to celebrate you, not just for what you have achieved, but for what you are. Your work has inspired us, your leadership has guided us, and your kindness has touched us all. Introducing such an acclaimed personality is not an easy feat for anyone. However, we have the most befitting person to do so, who I must make a special mention was also Dr. Sushanth's teacher. It is heartwarming to note that Dr. Sushanth was Dr. H. Sudarshan Ballal's first student in the year 1999. I warmly invite Dr. Sushanth Kumar B, Professor, Nephrology, KMC Hospital, Mangalore, to introduce his teacher to the gathering.
Good evening, respected teachers, distinguished guests, all the invited dignitaries, my dear friends, colleagues. It is my privilege, honor, and pride today to introduce my teacher, my mentor, my guru, my guide, teacher of teachers, Dr. H. Sudarshan Ballal, to this august audience. Actually, sir needs no introduction to this audience at all, because he is so well known and he is also part of our place. My association with sir dates way back to 1999, when I joined DNB Nephrology at Manipall Institute of Nephrology and Urology, part of Manipal Hospital, Bangalore. I was the first student then to be sir's student. I consider myself the fortunate first student. And Manipal Institute of Nephrology and Urology, part of MHB Manipal Hospital, Bangalore, was the only and the first center to start DNB Nephrology course in the state of Karnataka. This is the brainchild of sir, and all the credit goes to Dr. Sudarshan Ballal sir. Today, this unit has grown so much, it has become one of the premier institute in our country, producing so many gold medal students year on year. Dr. Ballal sir is not only a teacher par excellence, he is an astute clinician, excellent nephrologist, wonderful academician, above all, a great human being and a thorough gentleman. I am honored to be his student, and all we students feel proud and honored that we are his students. Now quickly, let me run through some of the achievements, accolades, degrees and awards what sir has achieved so far. I can't mention all. I'll be just highlighting few of them. Sir was the best outgoing student of the KMC College Manipal and a recipient of many gold medals in MBBS and MD. He later went to US and had the distinction of being one of the few to be having triple board certified degrees, namely internal medicine, nephrology and critical medicine. He has also the distinction of being appointed as Professor of Medicine both in St. Louis University, USA, and also the Adjunct Professor of Medicine in Manipal University. Later on, he was also conferred the Royal College Physicians Fellowship, FRCP, for his contribution to medicine. Sir was initially working as a consultant in nephrology and transplantation at the St. Louis University School of Medicine. Then he moved to the Manipal Hospital, Bangalore. He has been with Manipal Hospital, Bangalore ever since its inception as the director of Manipal Institute of Nephrology and Urology. Later served as medical director and chairman of Medical Advisory Board, and is currently holding the position of Chairman, Manipal Hospitals, MHCPL. He is also the chairman of Stempeutics Research Center, Private Limited, and he is also nominated as a member in board of management in MAHE. Now let me just mention few of the awards and recognition what Sir has issued, because the list is very huge. I'll just highlight few of them. Sir has recently got the Doctorate of Science from His Excellency the Governor of Karnataka, from the University of Rani Chennamma, Belgaum in 2022. He has received the Rajyotsava Award in 2005, Aryabhatta International Award twice in 2018 and 2024. He has been certified by INSEAD in corporate governance. He is the past Senate member of MAHE and Rajiv Gandhi University of Health Science. He is the past president of NAT Health, New Delhi. He is currently the examiner of MRCP UK and examiner and inspector of DNB by National Board of Examinations, New Delhi. He has numerous publications, both in national and international journals. He has been also invited as a speaker at many national and international forums. And he has played several roles in key decision making along with the state government of Karnataka during COVID time. So Sir is also actively involved in CSR activity, that is corporate social responsibility activity, through his family trust called Bellanje Sanjeeva Hegde Trust. So he supports more than 1,000 dialysis per year to the poor, free ambulance service to the poor patients with kidney disease, subsidized care for kidney transplant patients, namely poor patients with kidney disease, health insurance for the poor villagers in a village called Hebri, Sir's hometown, that's in Udupi district, free health checks for people with kidney disease, awareness program especially in association with philanthropic associations like Rotary and Lions Club. He also sponsors scholarship to the bright medical student wishing to be trained in nephrology. He launched the pediatric kidney transplant for the disadvantaged sections of the society under the name of Master Etharth, whose parents generously donated the organs after the unfortunate demise. This program is shared by the Sir's Trust and Manipal Hospital, Bangalore. He did a huge service, human service during COVID time, both providing free vaccines to all the dialysis patients and isolating hospitals for COVID separately during the tough times of COVID. Sir, you richly deserve this oration for your contribution and services to nephrology, and also the number of nephrologists, trained ones are produced by Manipal Hospital, Bangalore, and also the charity work that you do through your CSR activity. On behalf of your students and all the people, guests assembled here, I wish you health, happiness, prosperity, and more success, sir. Thank you, sir.
Thank you, sir, for doing justice to the mighty and daunting task of introducing our most distinguished Ballal sir. We are witnessing a very special event today. Before we proceed with the evening program, we have a special treat for you. As we gather here to honor the remarkable contribution of Dr. Ballal, we wanted to give you a glimpse into how his legacy has impacted those who have worked with him, learned from him, and been inspired by him. We will now share clips featuring the voices of his students, colleagues, eminent personalities who will speak about Dr. Ballal's unwavering commitment to excellence, mentorship, and leadership. These heartfelt reflections will offer a deep understanding of the profound influence Dr. Ballal has had on all of us. Please enjoy these clips as we celebrate the legacy of a true pioneer in healthcare.
I'm very glad to know that Manipall Institute of Higher Medical Education has started a lecture series in honor of Dr. Sudarshan Ballal, a well-known nephrologist. I have known Dr. Sudarshan Ballal for a couple of decades now. He has been a very successful nephrologist, not just for his competence in his profession, but for his empathy for patients, his concern for patients, and his ability to make them feel so much at ease. I wish this lecture series the best, because honoring people like Dr. Sudarshan Ballal in this manner is the right thing to honor ourselves. And I'm very happy that you have started this exercise.
From the team Mino, I would like to congratulate Ballal sir for being felicitated with the oration in his name. It's indeed a great privilege for all of us to be associated with Ballal sir for more than 2 decades. He is a teacher par excellence, excellent clinician, loved by all his patients. I would like to congratulate team KMC and thank them for instituting the oration in the name of our professor, Dr. S Ballal. And also I would like to thank the first speaker, Dr. Vivekanand Jha, for accepting the invitation and coming all the way for the oration lecture. Thank you and best wishes for the KMC team for the future oration lectures. Congratulations, sir. Congratulations.
Congratulations. Good day, everyone. I am Dr. Sridhar Reddy, consultant nephrologist at KIMS, that is Krishna Institute of Medical Sciences, Hyderabad. I was a student of Dr. S Ballal at Manipal Hospital, Airport Road, Bangalore. Under his esteemed guidance, we have learned so many things, not only in nephrology, but a lot of interpersonal relationships and professional as well as personal well-being. So he is a teacher par excellence, and beyond that, a great human being. There are so many great learning that we have had over a period of time, and even now we keep trying to learn and emulate in many of the fields of life. So I congratulate and wish KMC Mangalore Department of Nephrology, Dr. Sushanth, Dr. Mayoor V Prabhu, Dr. Ashok Bhatt, and many others who have put their heart and mind into conducting this oration on Dr. S Ballal sir. That will be a very great beginning, and no better personality than Dr. Vivekanand Jha, who's a professor and emeritus and a very, very well-known nephrologist across the globe. I wish them all the very best and wish all the program grand success. Thank you.
Good evening. I am Dr. Anup, consultant nephrologist in Prakriya Hospital, Bangalore. And congratulations to Team Mangalore KMC in conducting this first oration in the name of my beloved Guru, Dr. S Ballal, from whom I have learned so much in life, not only in the field of nephrology, but also about how to manage patients, management themselves, and also our esteemed colleagues. So these were the 3 important things that I learned from Dr. Ballal, and congratulating Dr. Jha in getting this opportunity to speak about Dr. S Ballal. Cheers, guys.
May I now request Dr. Sudarshan Ballal to kindly come over to the dais and grace the seat of honor. It gives me immense pleasure to call upon Dr. Hebri Subhash Krishna Ballal, Pro-Chancellor, Manipal Academy of Higher Education, Lieutenant General Dr. M.D. Venkatesh, Vice-Chancellor, MAHE, Dr. Sharath K Rao, Pro-Vice-Chancellor, Health Science, MAHE, Dr. Dilip G Naik, Pro-Vice-Chancellor, MAHE, Mangalore Campus, Dr. M Vijayakumar, Vice-Chancellor, Yenepoya, deemed to be University, Dr. Padmaraj Hegde, Dean KMC Manipal, to felicitate our most honorable visionary leader, Dr. H. Sudarshan Ballal, Chairman, MHEPL. I request our Dean, Dr. Unni Krishna Sir, also to join. I request Sagi Sir also to join the felicitation. I request our team of nephrologists, KMC Hospital, Mangalore, Dr. Sushanth, Dr. Ashok Sir, Dr. Mayoor Sir, Dr. Bhushan Sir, and Dr. Dushyant Sir to kindly come over to the dais. Thank you, sirs, for doing the honors. I respectfully request our esteemed visionary leader, Dr. H. Sudarshan Ballal, Chairman MHEPL, to share his thoughts and words of wisdom on this solemn occasion.
Good evening, ladies and gentlemen. I wasn't expecting to speak today. I was expecting only to listen to Vivek. But now that you have asked me to speak, at the outset, my mentor and guru, the Pro-Chancellor of Manipal University, and my brother who looks younger than me but certainly older, Professor H.S. Ballal, Distinguished Vice-Chancellor of MAHE, Lieutenant General Venkatesh, my very good friend, distinguished nephrologist, both at the national and international levels, and the speaker for today, Dr. Jha, the better half, I should say the much better half of Dr. S Ballal, Pro-Vice-Chancellor Dr. Sharath Rao, Pro-Vice-Chancellor Dr. Naik, Deans of KMC Manipal and Mangalore, Padmaraj and Dr. Unni, my colleagues in nephrology, both at Manipal and Mangalore, my friends who have come all the way from Bangalore, Dr. Sundar, Dr. Shilpa, and Sanjay, the Vice-Chancellor of Yenepoya University, ladies and gentlemen. I only get tongue-tied few times in life. There are two times that I really get tongue-tied. One is when I have to speak to my wife, and the second is when I am asked to speak when I haven't prepared for a speech. So I'm really tongue-tied today because I didn't honestly think I had to speak. And I must also admit, being a follower of my brother, I hope this event is recorded and all the good things said about me is recorded as a video and sent to my wife, since she could not be here. It's indeed a great honor to have an oration in your name, and more so if it's from your alma mater. I would like to thank all my nephrology colleagues, Dr. Mayoor in particular, Dr. Sushanth, Dr. Ashok Bhatt, and the entire team, KMC Manipal, Mangalore, and MAHE for organizing this. This is a great, great honor, and I'm indeed very grateful to all of you. It's been an honor and a pleasure for me to visit Manipal and Mangalore every time I'm here, because I'm a homegrown boy. I grew up in a place called Udupi, and those days, even to go to Manipal, you had to cross a dense forest called the Kundelkad forest, and there were tigers roaming there, which really was true during my younger days. And now we only see two-legged animals in Manipal, and the only relic of the tiger is the tiger circle, which is the main circle of Manipal. So what we have a lot of tigers like Dr. Sharath Rao in Manipal, but not the real ones that were there in the good olden days. I am proud to have been a student of Manipal since 1969. I started off with MGM Medical College in Udupi, followed by my stint at KMC Manipal, both from my MBBS and MD, before I left for the US. It's indeed very nostalgic when you come to Udupi and Mangalore, because I spent a lot of time in Mangalore since I studied in St. Aloysius and did part of my MD medicine under some stalwarts in Mangalore. So it's very nostalgic, and I feel very happy to be here. It sort of gives me an inspiration. And I always pray to God, and I've said this before, if there is a second life, then I would like to be born to the same parents, have the same siblings, same sisters-in-law, same teachers, and be in the same medical college run by the Pais of Manipal. And certainly have the same students, same friends, and same colleagues. I'd be very grateful. Once again, thank you very much for honoring me with this oration. I will not keep you away from the speaker of the day. And my heartfelt thanks to all of you. God bless.
Thank you, sir, for those insightful and inspiring words. We are indeed delighted and immensely happy to have you with us today. Ladies and gentlemen, we are privileged to have with us this evening a distinguished leader, a visionary, and a person of immense stature, Lieutenant General Dr. M.D. Venkatesh, Vice-Chancellor MAHE. His contribution to healthcare and his leadership in various capacities have left an indelible mark in our community. It is with great honor that I now request Lieutenant General Dr. M.D. Venkatesh to address the audience and share his thoughts on this significant occasion.
Very good evening, everybody, and warm greetings to all of you.
fact, as Dr. Sudarshan Ballal mentioned, I am also not prepared to speak anything on this occasion, but it's a great occasion. I'm privileged to be part of this wonderful event where we have two stalwarts, a person for whom the oration is being organized and a person who is going to deliver this oration. Two of the best known names in the field of nephrology, researchers of great repute, academicians of great repute, and more than anything else, they're great human beings. I have had the privilege of knowing both of them for some time now, and we've had the description of Dr. Ballal's achievements over a period of time, and in all fairness, it's very, very apt that for his extraordinary service to nephrology, to the humanity, to the healthcare enterprise, and more than anything else, his commitment to making things better for the humankind has been reflected in naming an oration in his name and being honored and recognized for that today. Many, many congratulations, Dr. Sudarshan Ballal. And we're also privileged to have his wisdom during the board meetings at MAHE, and we enjoy each other's company so much that Dr. Jha is also an advisor in MAHE, and his contribution towards the growth of public health and research at MAHE is highly acknowledged. Thank you so much, sir. So here we have the two stalwarts, and we heard one of them, and we await to hear. And it's in fitness of things that today, as we are coming to end of this year, the year 2024, we have a theme at the university for every year. This year it was the MAHE Year of Excellence in Research. And it is culminating in a talk by such a stalwart researcher in the field of clinical care and research should be the same two sides of the same coin. I think very relevant, very apt for the entire theme for the university. And I'm very happy to state that this Year of Excellence of Research at MAHE has scaled unprecedented heights. MAHE has already published more than 5,000 research papers this year, and we are poised to apply for more than 500 patents, and we have received extramural grants of more than 775 crore rupees. So in all fitness of things, the year has been excellent. And as we come to the end of the year, there's one more extraordinary event that we are witnessing today. I wish this event all the very best. I wish Dr. Sudarshan Ballal greater honors, greater recognition, and to Dr. Vivekanand Jha, more and more time with us, and also wishing you all the very best in all your future endeavors. And compliment to KMC Mangalore, KASTURBA Hospital, Atawar, and KASTURBA Hospital Jyoti Circle for organizing this and inviting us to be part of this wonderful event. Thank you very much. Jai Hind.
Thank you, sir. Sir, request you to kindly be on the stage, sir. Thank you for your kind and thoughtful words. Now I request Ballal, sir, to present a memento to Lieutenant General M.D. Venkatesh as a token of gratitude for gracing the occasion with his esteemed presence and support. Dr. Ballal, sir. Thank you, sirs. We are now at a very special moment in our program. It is our honor to invite Dr. Ashok Bhatt, Additional Professor, Nephrology, KMC Hospital, Mangalore, to the stage, who will introduce his esteemed teacher, Dr. Vivekanand Jha, to the audience. Dr. Ashok Bhatt, a highly respected professional in his own right, has had the privilege of learning under the guidance of Dr. Jha, and we are excited to hear his words of admiration and respect to the remarkable contribution of his guru, Dr. Jha.
Good evening to all the dignitaries, ladies and gentlemen who have assembled here for today's oration. It's a distinct honor and privilege to introduce a luminary in the field of nephrology, a visionary academic, and my esteemed teacher, Professor Dr. Vivekanand Jha. To those of you who are nephrologists in this audience, I don't think that Dr. Jha needs any introduction. Dr. Jha is not only a globally renowned nephrologist, but is also a mentor who has inspired countless students and professionals in the field of nephrology. Dr. Jha did his MBBS from Patna University and subsequently did his MD in medicine and DM in nephrology at the PGI Chandigarh under the mentorship of late Professor Dr. K.S. Chugh. And in 1992, he went on to join the Department of Nephrology as faculty in PGI Chandigarh, where he continued to work till 2013 as a professor. And subsequently, he has moved to the George Institute of Global Health, where he is working as an executive director, and he is a professor at Imperial College, London. Dr. Jha has had a keen interest in research right from his early days, and it's probably this keen interest in research which took him to US. Probably I was a junior resident at that time, and by the time I came to the Department of Nephrology, you had returned back from US. And he did a basic science research fellowship in US and came back to PGI, which not many people do after going to US. So he came back and he set up a basic science research lab in PGI Chandigarh in the Department of Nephrology, which was the first of its kind in India. He subsequently went on to establish in 2006 a Department of Translational and Regenerative Medicine at PGI Chandigarh, also with the help of Government of India. His research areas span almost the entire gamut of nephrology. If you look at his research papers, he has papers on glomerular diseases, chronic kidney disease, hemodialysis, renal replacement therapy, stem cell research therapy, and so on. He has numerous publications in many prestigious international journals and has an amazing H index of 111. I think this would be a dream for any research scholar. His current focus of research is on technology-driven interventions to try and help in identifying and treating kidney diseases in resource-limited settings. Dr. Jha and his team, along with several collaborators internationally also, are running several trials along the same lines. Dr. Jha has also held prestigious leadership roles throughout his career. He was the Secretary General elect to the Indian Society of Nephrology in 2006, a position which he held for 6 years. He has also held the prestigious position of President of the International Society of Nephrology from 2019 to 21. He has been a strong advocate of evidence-based medicine, and he has been on the advisory board and the executive board of several organizations which develop evidence-based guidelines, including the KDIGO, World Health Organization, and also the committee established by the Government of India to develop clinical practice guidelines for kidney diseases in India. So, on a personal note, I have had the privilege of being guided by Dr. Jha, whose teaching is not just limited to the lecture hall. He is a brilliant clinician, hardworking, punctual, and disciplined, and he expected the same from the students. There were no concessions given. His passion for knowledge and his ability to instill these values in his students and to foster curiosity and critical thinking have left an indelible mark on all his students, including me. Today, we are fortunate to have Dr. Jha with us for this oration lecture. I am confident that his words will be inspiring and enlightening. If I continue to list Dr. Jha's achievements, I don't think that there will be any time left for the oration. So, ladies and gentlemen, please join me in giving a warm welcome to my mentor, an exceptional clinician, researcher, and teacher, Professor Dr. Vivekanand Jha. Welcome, sir. The stage is yours.
Thank you very much, Ashok. When Ashok came to introduce me, I was somewhat suspicious because there is a tradition in PGI that you always challenge others and don't take anything on face value. So I almost expected Ashok to come and reveal something about me, which perhaps I may not want to be known, but you didn't do that, Ashok, so thank you very much. I'd also thank the Department of Nephrology of KMC Mangalore for inviting me to deliver this oration. And you know what it takes for me to get to come here. It is an oration named after my dear friend, Dr. H. Sudarshan Ballal. So, as Mayoor Prabhu was saying, it took 10 years, but this is what it takes, right? So, when this offer came to me, there was no way I could have said no. And for some of you will know, but many may not, that Sudarshan and I have known each other for almost 35 years. Almost since the time I started my career after finishing my residency in nephrology in 1990. And in 1991, the nephrology community in the country was really very small at that time. And we were looking for colleagues who we could work with, we could collaborate with. And then I heard that here is this nephrologist, triple board certified nephrologist who's come back from the US. And resolved that we must meet and try to find how to work together, etc. And eventually we found opportunities to meet in the Indian Society of Nephrology meetings and subsequently have continued our interaction and remained friends and potential collaborators in many things. Dr. Sudarshan Ballal's contributions in nephrology in the region are well known, and they have gone beyond nephrology, as we all know, and I don't have to repeat them, they have been said, and you know them better than me. So the honor is actually mine to have been asked to deliver the inaugural oration instituted in the name of Dr. H. Sudarshan Ballal. Now, institution of an oration is also a real high water landmark in someone's career. Usually, and again I emphasize the word usually, it indicates that your career is coming to an end and perhaps you are downhill. But there are exceptions to every rule, and this is one of those exceptions. We all know, and by looking at them, no one will say that Dr. Ballal doesn't have a long career still ahead of him, has a lot to contribute, as many people have commented upon, and we all look forward to his increasing contributions which benefit the society, which benefit individuals, but which really benefit the larger ecosystem. So thank you for Sudarshan for all that you have done, and thank you to KMC Nephrology Department for recognizing his services and instituting an oration in his name. So again, the topic, as you see listed here, that I chose to give is this one here. So again, when Professor Mayoor Prabhu asked me what is the topic that you would like to give your oration on, I suggested to him 2-3 choices, and he picked this one. And for the reasons that General Venkatesh already mentioned, that MAHE is celebrating this year as the year of research. So he said this will be an appropriate topic. And as you can see on this slide, that even though my primary appointment is with the George Institute for Global Health, the George Institute for Global Health and MAHE already have established relationship, and we work together in many areas. And we expect to grow this relationship further and hope to be able to strengthen the mutual bond of collaborative research that we are developing. So I expect that a large number of you here in the audience are medical professionals, medical doctors, or other medical professionals in some way or the other. And we often, during the course of our day-to-day medical duties, don't think about research as we go along, providing patient care services, etc. But I am hoping to make the case that we should be thinking about research even as we practice medicine on a day-to-day basis. Let's just get some definitions out of the way. The first definition is what is clinical care. So the clinical care, as we all understand as clinicians, is the direct provision of medical treatment and services to patients. Whereas clinical research is slightly more, longer term to define, which is a component of medical and health research, which is intended to produce knowledge that is valuable for understanding human disease, but more than anything else, preventing and treating illnesses and promoting health in general. If we go back to the words of Dr. William Osler, who said, medicine is the science of uncertainty, but an art of probability. And that is where research comes in, actually, as to how to marry this art and the science. So let's imagine this scenario where here is a woman in a rural medical clinic where there is this doctor who is trying to examine the baby who the mother has brought. And the only question in the mind of the mother is, what treatment should I pursue to rid my baby of this illness? But the physician or the pediatrician doesn't have just one question, but several in his mind. In this case, this is a male doctor, so in his mind, he thinks, how do I find out what the baby has? What are the likely outcomes of whatever condition that the baby has? What are the odds of an outcome that I don't look forward to? How do I identify whether this patient is at risk of such a bad outcome? What are my choices once I've made a diagnosis? Is there any downside to implementing these choices? So when I say choices, I mean treatment choices. And what is the course of action eventually that reduces the odds of a bad outcome at the least cost? So a range of questions are going through the mind of the doctor, and I'm sure that we all go through this checklist of questions unconsciously. We don't even, identify each question and then try to answer those questions. So I'd like to present to you that the act of patient care itself is an experiment, because every individual begins in a baseline state. A patient who comes to your clinic, he or she will receive an intervention and will have an outcome, which is really the principle of research, which is shown here in the cartoon on the right. And we always define a research into 4 components, again, P, I, C, O. So P is the patient or the population or the problem, I is the intervention or the prognostic factor or the exposure, C is the comparison that we are trying to make, and O is the outcome that we are trying to look forward to. Why do we do research? So let me go back to, we have several illustrious deans here, so I'll take you back to the word of a dean of Harvard Medical School, almost a century ago, who said to medical students in his commencement address, he said, half of what we are going to teach you, and I hope that this doesn't alarm new medical students if there are any in the room. He said, half of what we are going to teach you is wrong and half of it is right. But our problem is we don't know which half is which. And we still are in more or less the same situation. A lot of what we are going to teach you today is going to be proven wrong in the next 20 or 30 years, which has been the case of Ashok Bhatt. What I or some of us taught to Ashok Bhatt was probably proven wrong later on, and the same thing with our teachers when they taught us. So this has actually been proven. So this is a book which I'll encourage many of you who are interested to actually have a look at. It's called Ending Medical Reversal. It's written by an American oncologist, Vinay Prasad, and Adam Sifu is a primary care physician. So what they did is they collected articles published in prestigious journals like JAMA and Lancet and New England Journal of Medicine. They identified more than 2,000 articles, looked at 1,300 odd, which concerned a medical practice, a type of medical practice. For example, treatment of pneumonia with azithromycin. This is a medical practice. I'm not saying this is what they tested, but this is an example of medical practice. They then saw that this is 1,300 odd articles, out of which more than 900 tested a new practice, whereas 363 tested what is called an established practice. So treatment of pneumonia with azithromycin is an established practice. Is it right? Is it not right? So that is what they were trying to answer. So when they looked at these articles, which tested an established practice, what they found that almost 38% of these established practices were found to be correct, but almost 40%, an equal number, were found to be bad or not useful at all. So which means that they were, even though we were engaging those practices, they were wrong. And that's why we need to do research, right? It's important also to mention that often we think that because of the mechanism of action, we think whatever is the intervention A should work in this manner. So we make this deduction in our head. But we have to recognize that bioplausibility is not causality. Just because something should happen the way you think it is, it doesn't always work out that way. So what it means is that don't just assume that things will work out without testing them, and that testing can only be done through research. I'm going to give you an example from the field of nephrology. So again, I'm sure that Dr. Sudarshan Ballal, Dr. Sundar, etc. will remember that those days when we started giving dialysis, and at that time there was this belief that the more dialysis you give, the better the patient's outcome will be. And so that was because, dialysis is something which is going to replace the filtration function of the kidney, and since the filtration function of the kidney has been lost totally in a patient with end-stage kidney failure, you keep on giving more and more of it and the patient should do better. But then this was tested in this trial called the HEMO study, and what they did is that they randomized patients to receive either the standard dose dialysis, which is 3 times a week, or a high dose, or another type of dialysis called high flux dialysis. But what they found, which you can see in this Kaplan-Meier survival curve, is that there was no difference in the outcome whether the patient received standard dose dialysis or higher dose dialysis. So something, again, this bioplausibility is not exactly how the knowledge pans out in the longer direction. Now, just transitioning on to a few just general points, maybe philosophical points. We all have benefited from the existence of the social practice of medical research. Every medicine that you take, paracetamol for a headache or an antibiotic for a respiratory infection, has been tested in clinical trials, anti-diabetic drug, antihypertensive, etc. Many of us would not be here if infant mortality had not been brought under control, if antibiotics had not been invented, if there were no COVID vaccines or platforms trials like the recovery trial that was done during COVID. And it is, again, given that we will continue to benefit from these and other medical advances even in future. Now, since we accept these benefits, we also have an obligation as medical professionals to contribute to the social practice which produces them. And what produces them? It is only research that produces them. The history of research is long, but modern research perhaps can be traced back to this paper in 1945, which was the MRC trial of streptomycin for treatment of tuberculosis, published in the British Medical Journal, which was perhaps one of the first modern scientifically done randomized clinical trial. Although the history of randomized clinical trial goes back to Greek times, and more recently in the time of James Lind, when he treated sailors who were developing scurvy by giving them lemon or giving them other things, etc., and found that the sailors that were given lemon got better, whereas others did not. Here is another example of how research improves clinical care. So it is a fact, and we know this now, that the survival rate for childhood cancers has quadrupled over the last few decades and now exceeds more than 80%. So 80% of children with cancers, if they receive proper chemotherapy, they will probably get cured. And a large credit for that goes to this organization called the Children's Oncology Group in the US. 90% of children with cancer in the US receive care in centers affiliated with this network. And what this network does is to randomize pretty much 2/3 of the children who come under their care in clinical trials. And that is the way they have been able to improve outcomes in children who receive treatment for cancers. Research findings also influence clinical protocol. Again, going back to our field of nephrology, we all are aware of this path-breaking trial which was announced 4 years ago in 2019 called the Credence trial in the World Congress of Nephrology at Melbourne. And soon after, it was adopted in guidelines and it started being used. In India now, it is off, generic preparations are off, SGLT2 inhibitors are available, and it offers huge opportunities to patients with clinical trial, patients with diabetes and kidney disease and cardiac conditions, right? And subsequent research also showed that it is effective even in non-diabetic kidney disease, right? So this is what research has done. It has provided wonderful opportunities for our patients. But despite all of this, what is the current scenario of clinical research? Only 5 to 10% of eligible adult patients are engaged in clinical research. The situation is better in pediatrics, as I said, because of some of the pediatric groups having become more organized and being able to enroll more children into clinical trials. There are a number of challenges in recruiting patients which delay completion of many trials. Participation rates are lower in certain groups, especially disadvantaged groups in many societies. Our rural populations also, it's very difficult to get them to participate in clinical trial. And all of this makes the process of generating medical evidence slow and inefficient. What it also does is that because we are often relying on clinical trials which have been conducted in North America, Western Europe, etc., to information generated there to treat patients here in India or in Africa or in other locations, which may not be generalizable necessarily. So if we have, fortunately, if we from India are better than many other countries in recruiting subjects in clinical trials, although not really where I would like all of us to be, the generalizability of those trials is relatively limited. Research and clinical practice is often siloed at the level of the institution also. Institutions have separate research, accounting, and patient information systems which don't talk to each other. For example, often accounting is prioritized when development of hospital information systems is concerned, because they want to see how money is flowing rather than investing in electronic medical records which will support conduct of research. Engaging patients in clinical research, which is screening, consenting, and coverage of care, it is time consuming. And our clinicians are incredibly busy. They are not reimbursed for all of these things. That is something which hospital administration should look into, so that our clinicians have at least some time for which they are also adequately compensated so that they can contribute to research activities. There is generally cultural incentive. Like I said, there is no protected time. People don't get any incentives. There are regulatory challenges. Our ethical, and this is not unique to one institution, across the country we find that ethics committees are very difficult to deal with. And they often really don't understand what the ethics committees are supposed to do, and will produce roadblocks just for the sake, because I have the power, I will obstruct something. That is the attitude many ethics committees take. Research systems often depend on funding, so even if a hospital has set up some research infrastructure, because constant research funding is not available, that infrastructure is actually dissolved once funding for that specific project is ended. One concept which I would like to leave you with is this concept of randomized care, being better than giving random care. So what is randomized care? Randomized care is when someone is enrolled in a clinical trial and might be randomized to receive one treatment or the other treatment, or in cases of adaptive trials, now there might be many arms of a clinical trial. So again, I go back to the words of Dr. Barry Friedman, published in New England Journal of Medicine almost in 1987, in fact. And he goes on to say that ethics of medical practice grant no ethical or normative meaning to a treatment preference, which is based on a hunch or anything less than evidence, which is publicly presented and convincing to the clinical community. I remember during my training days, many of our teachers, they gave you some information. And when you ask them, why do you say so, and the answer often was, because this is the way I do it. But that is what Dr. Friedman goes on to say, that is not really the appropriate way of doing it, unless it is proven in an evidence-based manner. And he also says that persons are licensed as physicians after they demonstrate the acquisition of professionally validated knowledge not after they have simply revealed a superior capacity for guessing. So that's something which is also worth remembering. Dr. John Harris, who's an ethicist, said in 2005 that biomedical research is so important that there is a positive moral obligation for all of us to both pursue it and participate in it. So, what is again, coming back to the difference between clinical research and patient care. In patient care, we focus on individual patients, whereas in research, we focus on populations. Clinical care and research, I hope I have been able to demonstrate to some extent that they are interconnected. Clinical care informs research and vice versa, and that evidence-based medicine is critical in clinical decision making rather than just what was earlier called an eminence-based medicine. So this is a Venn diagram of the various type of groups or infrastructures or systems that overlap and produce a well-oiled clinical system as well as research system. So the participants in this enterprise are healthcare organizations, which could be both payer, provider, government, hospitals, etc., life sciences organizations such as research labs and what have you, research organizations like the one that currently I work in or many other research organizations. There could be academic, there could be industry, or there could be government. And finally, care delivery organizations, which will be hospital, academic medical centers, other types of medical centers. And their goals are often distinct, but they also overlap, as you can see here in this Venn diagram. So it's also important that understanding of research is helpful in delivering good clinical care as well. And why is this so more now than in the past? Because now clinical practice guidelines are going to become increasingly important, and all of us will be expected to follow clinical practice guidelines. Establishment of standards and protocols is becoming more and more relevant everywhere. Quality assurance programs are being set up or are being required to be set up, especially by accreditation agencies that come and inspect hospitals. Decision support systems and tools are being developed, so now we will have decision support tools on the computer, and the computer will perhaps tell you, this is what you should do next. This is the blood pressure, this is the blood sugar, the next step should be this. So this is what is done by decision support tools. And now patients are also empowered. I'm sure that we deal with patients who actually do their own research by looking up Google, and large language models have made this problem. So people now have access to ChatGPT, and they will go and ask a question of ChatGPT. ChatGPT, I have diabetes, my blood sugar is this much, I'm taking this medicine, what should I do next? And they will get an answer. And they will come and challenge you with the answer, because ChatGPT answer will be based on clinical practice guidelines. It will not be based on personal hunches, etc. And this is now being increasingly recommended also. So this is perhaps too short to read here, but in a condition called IgA nephropathy, the clinical practice guideline organization called KDIGO actually recommends that if a person has IgA nephropathy and is determined to have high risk of progression, the first thing we should do is to enroll that patient in a clinical trial than give any random treatment. So this is what I was suggesting when I said there is a difference between random treatment and randomized treatment. So these are also again recapping the benefits of integrating clinical care and research. It leads to improved patient outcomes. It promotes evidence-based practice. There is faster translation of research findings into clinical practice. It also gives you professional development and a sense of satisfaction. It allows us to improve research utilization by preventing the use of wasteful medical care. That's a big problem in medicine, which we don't often appreciate. How do we do what is called low value care? So we want to move away from low value care. It promotes a culture of learning, innovation, and continuous improvement, so important in institutions like KMC, Manipal Academy of Higher Education, etc. It also empowers the patients and strengthens trust in healthcare providers. Often we lament that the patients don't trust medical professionals as much as they used to do in the past, etc. However, we do recognize that there are a number of challenges in integrating clinical care and research. Time and resource constraints are some things I mentioned. It is difficult to balance research priorities with patient care responsibilities also. Let's face it, many of us have not been trained in research during our medical training. And that is something that medical institutions, universities need to fix. We need to institute appropriately designed research training programs as part of our undergraduate and postgraduate medical curricula. Absolutely, it's important. And there must exist an enabling ecosystem. Regulatory environment needs to get better. And of course, we need to make sure that we provide the appropriate ethical environment for research involving patients. But then we must recognize that the culture is changing. Larger and bigger trials are becoming possible through clinical trial networks. The patient engagement is promoting and encouraging more and more patients to participate in clinical trials. There are novel trial designs. I don't have time to get into that, but for those who are interested, get in touch with me and we can talk about them later on. One thing which I would like to describe to you is the difference between the explanatory and pragmatic clinical trials. So the traditional type of clinical trials, which are done by pharma companies, the drug trials, etc., are what are called explanatory clinical trials, which are meant for getting regulatory approvals, right? And the characteristics of explanatory clinical trials is shown here on the left. They are narrow, highly targeted, and they require strict protocol. They have parameters which are very specific to the trial. But now we are moving to the pragmatic trial design, which are broad, which are conducted in clinic in the context of usual clinical care. They have flexible protocols. They use available metrics and use an intention to treat analysis. So it is easier to participate in these pragmatic clinical trials because they are much more aligned to our clinical practice. There are a number of other enablers of integration of research into clinical practice. And again, this is not the time to dwell into the details. This is slightly more nuanced, and perhaps we can discuss this later on. But there is new culture of real-world evidence movement, which is easing the conduct of research into routine clinical practice and patient-reported. So patient can tell you what are the outcomes that they find important. The use of electronic health record has improved our ability to collect outcome data, etc. And of course, artificial intelligence will help us. COVID-19, bad though it was for all of us, it taught us a lot. And many countries have actually transformed their research infrastructure. This is just the first 100 days of COVID shown here on this timeline. You can see that, and this is what happened in the UK. So this is taken from the UK response to COVID healthcare. So January 31, 2020, the first UK COVID-19 confirmed cases were seen. Then you can see here that just in less than 2 months, they had, as they had the first COVID-19 confirmed deaths, they put in place a draft of the recovery trial protocol, the famous recovery trial, and within 15 days they had gotten ethical approval and implemented the trial in all hospitals across United Kingdom. Within about 1 month, they had enrolled 1,000 patients in recovery trial. Within about 2.5 months, they had enrolled 10,000 patients. And within about 3.5 months, they had already demonstrated that dexamethasone was superior to not giving steroids. And so within 3.5 months, they came out with the most impactful finding of COVID-19, which saved millions of lives worldwide. And how was it possible? It became possible because they made randomization as part of routine care. So everyone who was treated for COVID-19 in UK hospitals received a randomized treatment of some sort or the other. It was an open, collaborative, and coordinated response. Clinical research was prioritized even in the context of a pandemic which caused havoc all around the world. They were able to successfully remove all the barriers from research in the hospital. This was quite unique to the UK, I must say, that other countries, including the US, were singular failures in implementing this, and they were not able to do the kind of research would have helped in advancing the state of knowledge in COVID-19. And that way, the UK healthcare system became what is called a learning healthcare system. There may still be a number of us who may yet not be interested in research. So the question is, what to say to them? The thing that I would say to them is that they may not still be thinking broadly enough about what research actually is. We all know that all of us as responsible clinicians evaluate our own practice also. What are we doing which works? What are we doing that does not work so well? We, as part of our ongoing medical knowledge gathering, we need to be able to critically review research which is done by someone else also, so that we can decide whether that finding of that research is appropriate for us. We need to know how do we apply clinical practice guidelines in our settings. Often people think that opportunities to apply or participate in research are limited, but that is not so. There are so many opportunities. There are a number of key domains of research shown here. So you can look at whatever you like. There is descriptive research, there is discovery research, there is implementation research, and then there is cross-cutting themes of research. And MAHE, for example, has a very strong data science group, and so they do this kind of cross-cutting research. But then you can look at any of the boxes here that may appeal to you. So the world of research is quite diverse. So the choice of research domain can be influenced by a number of factors of the individual. It obviously, personal interest and passion plays a big role into it, as does education, background and training. But one of the most important ones that I'll pick up is the mentorship and role model. So people like Dr. H. Sudarshan Ballal, etc. are people that you should kind of latch on to, because you will learn a lot from them. You need to look at career advancement opportunities, and there are many other social and health needs if you are important, if you are into understanding of social needs, etc. There are personal considerations. Geographic location will also sometimes influence the kind of research that you may be able to do, or you may want to be able to do. And if you are interested in the big questions, you have to think whether it's a big question. What is going to be the impact of the research, and so on and so forth. So often, if you are curious by this point, you will perhaps be asking the question, how do I start? And I'll draw your attention to Dr. Atul Gawande, who's written many books, is at the Harvard, and I'll show you a few quotes from this book called Better, and he there gives this advice: observe and count something that you find interesting. So that is the easiest way to start doing research. Counting something interesting will lead to learning something interesting. Ask unscripted questions. No, there are no stupid questions. No? There is no question that comes preformed. If there were only preformed questions, then discoveries would not have been made. One thing which you should get into the habit of doing is writing something. Just write anything, whatever comes to your mind. There are no bad writings. No one is going to look at you except yourself. And nobody produces a perfect first draft. First drafts are always bad. And this is something which sounds like preaching, and this is something which our teachers used to tell us, but I think teachers these days are not allowed to say this. Don't complain and change yourself. That is something which we all need to do. What it allows us to become is what Dr. Gawande calls a positive deviant. And he goes on to say that better is possible. It does not take genius. It takes diligence. It takes moral clarity. It takes ingenuity. And above all, it takes a willingness to try. Here is an example. And again, this is very small, so you won't leave it. You won't be able to look at it or read it. But this may sound ridiculous, but there is this one person who, when he was young, was told that cracking your knuckles will lead to the development of arthritis. So what this person does, this person was a medical doctor. For the next 50 years, he cracked the knuckles only of one hand, and the other hand he used as a control. 50 years later, he concludes that no arthritis, so cracking knuckles does not lead to arthritis. So this is apocryphal story. What it means is that if you want to do research, you can do it. And he was able to publish it. It took him 50 years, but he published it, right? If you want to do research, you may be able to do it. And the last line, I don't think you can read it, but he says that this study was done entirely at author's expense with no grants from any government or pharmaceutical sources. You should also ask a few questions. Are you going to observe, or are you going to become even more adventurous and you want to do some experiments? So there are many ways of doing observational studies shown here on the left, and there are some ways of doing experimental studies also, which are shown here on the right. And again, I won't perhaps go into the details of all of this. Now, as I said, the COVID-19 pandemic gave a lot of fillip to research, and the WHO has come into action. This is one of the recent publications from the UK Oxford Clinical Trials Unit, which was responsible for running the recovery trial across the UK, and they list out the 5 principles of good randomized clinical trials. So the principle number 1 is that good randomized clinical trials are designed to produce scientifically sound answers to relevant questions. They respect the rights, safety, and well-being of participants. They are collaborative and transparent. They are designed to be appropriate for their context. And finally, they manage quality effectively and efficiently. Since then, the WHO has released just this month this Global Action Plan for Clinical Trial Ecosystem Strengthening. And if you're interested in clinical trial, I would encourage you to go and have a look at it. And look at this action number 7 here. WHO says that we should encourage clinical practitioners to integrate clinical trials into health systems and practices. So even WHO says this now. And they go on to say and present many examples of this action 7 in terms of detail on how this can actually be done. Now, changing tracks from clinical trials to another type of research, and it may surprise you that it takes an average of 17 years before research findings are translated into practice. You know, it is becoming this time period is becoming less. As I said, credence trial, the reporting of results and translation to clinical practice took just a couple of years, but traditionally it takes a long time. The question is, why does it take so long, and why is the uptake so poor? I'm going to show you this one piece of data, which is from the Indian Chronic Kidney Disease Study, which is a nationwide network of patients with chronic kidney disease, and we published data from 4,000 patients who are part of the ICKD study. So these are patients of chronic kidney disease, and those who manage patients with kidney disease know that use of renin-angiotensin system blockers is supposed to be the standard of care for managing these patients. But even now, despite more than 25 years after their discovery, less than half of the patients, here you can see 48% RAS blockers, less than half of these patients are actually receiving this treatment. So still, despite the knowledge being there, it is not implemented properly. So there is a need for what is called an implementation research. And so you can also be interested in implementation research, which helps in developing reliable strategies, producing generalizable knowledge, and test and refine implementation theories and hypotheses. There are a number of implementation research ideas, some of which are again listed here. No need to go into details of them, but there are a number of things that you can do. But in the end, you have to generate your own research question. The best advice that I can give you at this point is, to the youngsters at least, is read a lot with an inquisitive mindset. Follow trends. It is easy to do this now with all kinds of search engines on your fingertips. You are sitting here in this hall, you have your phone in your hand, you can actually follow trends right now, as you do on social media, etc. Get inputs from others, and I come back to the point of identifying a mentor. Use these 2 principles called FINER, which is shown here. The point or the research topic that you are interested in, it should be feasible, it should be interesting, it should be novel, it should be ethical, and it should be relevant. And PICO, this is something which I mentioned right in the beginning, that you identify the population, the intervention, the comparator, the outcome, and the time it will take to do so. You create a hypothesis and objectives and scout for resources. This is a paper which was published only yesterday in time for Christmas, and the authors say, all I want for Christmas is a precisely defined research question as my present. Now, coming towards the end, there are a number of opportunities for clinicians in research. As I said, you have to identify your interest, which should be aligned with your practice and with your patient populations. If at all possible, join a research network. That is the best thing you can do. Look for capacity building opportunities, the research fellowships that are available. Stay abreast of advances in research methodologies and identify funding opportunities. Some of the opportunities are shown here through the Indian Council of Medical Research, through the Wellcome Trust DBT India Alliance, and I was telling you a moment ago about the Indian Chronic Kidney Disease Network. So for the nephrologists among you, you can join this network, which has centers in many cities, academic medical institutions across the country. So therefore, I'll leave you with these two takeaways. Every clinician can contribute to research through observation, critical evaluation, and application of evidence to improve patient care. And that better is possible. It takes diligence, moral clarity, ingenuity, and willingness to try. And the last picture I'm going to show you is this one. This is a picture from the days of my residency training. And here you have in the center my mentor and Dr. Ashok Bhatt mentioned, Professor K.S. Chugh, from whom we learnt a lot. But the point of showing this slide is not to show Dr. Chugh, but this person here. This is me with black hair at that time. And this person here, Dr. Anupam Agarwal, who is an alumnus of KASTURBA Medical College, Mangalore. He has gone on to become the Dean of University of Alabama at Birmingham, one of the finest researchers, nephrology researchers. And it was so interesting that Dr. Anupam Agarwal and I were the presidents of two largest nephrology societies in the world at the same time. This is something which probably has not happened in the past and will not happen in future, because how likely is it that people who train together are likely to, thrown by chance to be in a position where they get this opportunity. So it is possible that there is an Anupam Agarwal sitting in this room and he or she will come out. So what I mean to say here is that there is talent everywhere, there is potential everywhere. It is up to us, it is up to the entire system to bring the potential out from amongst the people who are present all around us. Thank you very much for all your attention, and thank you once again for giving me this honor of delivering this oration.
Thank you, sir. You have truly inspired us all here today. Your insight and expertise are truly appreciated. I request all the audience here to give a standing ovation to Dr. Jha. Please be seated. I now invite Dr. Sudarshan Ballal sir and Dr. S Ballal sir, Lieutenant MD Venkatesh sir, Dr. Sharath sir, Dr. Dilip sir, Dr. Vijayakumar sir, and Dr. Padmaraj Hegde sir to kindly come over to the stage. We request Dr. Jha to kindly join us. Please be seated, sir. Thank you, sirs. I request all the dignitaries on the stage to remain on the stage. As a gesture of heartfelt gratitude, I request Dr. Sudarshan Ballal sir to kindly present a token of appreciation to Dr. Sharath K Rao, Pro Vice Chancellor, Health Sciences, MAHE. Dr. Dilip G Naik, Pro Vice Chancellor, MAHE, Mangalore Campus. Dr. M Vijayakumar, Vice Chancellor, Yenepoya, deemed to be University. Dr. Padmaraj Hegde, Dean KMC Manipal. Thank you for gracing this occasion and supporting us in making this occasion truly memorable. I request our Ballal sir, Sudarshan Ballal sir, to be on the dais, please. In the loving memory of late Dr. Gurpur Guni Lakshman Prabhu, a beacon of knowledge, compassion and humanity, he touched countless lives with his healing hand and kind heart. His presence remains etched in our memories, and his legacy continues to inspire us to serve with purpose and dedication. Forever remembered and for request Ballal sir to kindly present the memento to Mrs. Kavita Lakshman Prabhu. Thank you, Ballal sir, for invite our most distinguished guest and our beloved leader, Dr. Hebri Subhash Krishna Ballal, Pro-Chancellor MAHE Manipal, whose vision and leadership has been instrumental in shaping the success of this event to deliver the presidential address. Dr. Ballal's dedication to the field of healthcare and his unwavering commitment to excellence has inspired countless individuals. His address will undoubtedly set a tone to this evening and inspire us all. Over to you, sir.
Bridegroom of this evening's program, my dear youngest brother, Dr. Sudarshan Ballal, our guest speaker, Professor Vivekanand Jha, my Vice Chancellor, Lieutenant General Dr. M Venkatesh, other dignitaries, and my dear friends. Long drawn program. My wife said you can't speak for more than 2 minutes. Definitely I won't talk. See, I was too impressed with two things today. One is Mayoor Prabhu's excellent welcome address. I'm really very impressed with that. Not because he mentioned that I presided over and I said I missed my wife and all. But it was really good. And also for arranging the first oration in my brother's name here at KMC Mangalore. Thank you very much, Mayoor, for the good work. And the invocation, I don't know where that boy is. It was brilliant. I would like to use him at Manipal in one of these programs very shortly. So you must give me his details. I am very happy to be part of this inaugural oration ceremony of my younger brother, Dr. Sudarshan Ballal, a nephrologist of great repute, by another nephrologist of great repute, Professor Vivekanand Jha. It was brilliant, I tell you. Even a lay person like me, I could grasp a lot of things, probably. Some of the things that you said, that research culture should be inculcated in the undergraduate days itself, undergraduate and postgraduate days. Very, very important. That culture is very important. And I am very happy and proud to say that my Vice-Chancellor, Lieutenant General Venkatesh, is giving a lot of importance for research and developmental activities in our university. And this year, as he said, and our university today is ranked number 4 in NIRF, National Institutional Ranking Framework. And those above us 3 are public universities. The public universities have a lot of advantages, head start over private. So you can say virtually it is number 1 university in the country. So I would like to acknowledge that. Please, Nilri, ಸ್ವಲ್ಪ ಬೇರೆಯವರು ನೋಡ್ಲಿ. Our Vice Chancellor, Lieutenant General M Venkatesh. I always say, please sit down. And also, Mayoor said, I was in KASTURBA Medical College for a long period of time. Any opportunity that I get to visit Mangalore, I never leave that, because I should thank Unni Krishnan and also Mayoor for giving me an opportunity. It is like homecoming, isn't it? Though I was not an old student of KASTURBA Medical College, Mangalore, I spent prime part of my life here at KMC Mangalore in various capacities from 1971 to 2003. 32 long years I spent here in Mangalore. And I strongly feel whatever I am today, whatever achievements I have made, it is mainly because of my long association with KASTURBA Medical College, Mangalore. So it's like homecoming, so I did not want to lose that opportunity. About my wife, Mayoor said, I always say, when any function, program, when you introduce a chief guest, you go on praising him, whether he deserves it or not, isn't it? And my wife, I always tell her, if somebody calls me as a chief guest to come, many times she doesn't come. Why I call her? Because when she hears that praise, at least my reputation at home will scale to greater heights. That is the only reason why I call her. But anyway, today she is here, and you mentioned that. I should thank you for that also. And this is very important, as far as Vivekanand Jha ji, see, KASTURBA Medical College, we have the largest number of students, undergraduate students, MBBS students doing research in our university, the largest number. And also the dean, boss of this, where is Unni has left, is it? Unni is, see, top 2 percentile of researchers of the entire globe, world, are from MAHE, Manipall Academy of Higher Education. 36 in number, isn't it? Of which Unni Krishnan is one of the leading researchers. So that reputation KASTURBA Medical College, Mangalore has. I always say, as an institution or a university, you have 2 responsibilities. Imparting the existing knowledge which is there in the books, and now with all these coming, Google, Giggle, and students know much more than you said, Chat GPT, GPT, artificial intelligence and all. But creation of new knowledge, that is very important, because change is constant, they say, and also learning is a continuous process. Lifelong learning you must have. Just because you get a degree, it doesn't mean that you know everything. They say, as you said, research, what we know today, half of it is proved wrong in 15 or 20 years. Unfortunately, we do not know which half it is. All the more reasons you have to update yourself with the recent advances. Otherwise, you will become irrelevant. Not only students, your peers, nobody will respect you. And from the patient care, we have a great responsibility in patient care. We have to provide them the best treatment, latest treatment, isn't it? So that is very important. So as medical professions, we have a great responsibilities. So thank you, Vivekanand Jha, for enlightening us about the importance of research, that too in the inaugural oration of my brother Sudarshan Ballal. So I would like to, in conclusion, because my time is up, I think I have already exceeded the time. Once again, I thank Vivekanand Prabhu, Mayoor Prabhu, and all his other colleagues of Nephrology Department of KASTURBA Medical College, Mangalore, for giving me an opportunity to preside over this function. And I wish all of you the very best. Thank you very much for the opportunity.
Sir, request you to stay behind, sir. Thank you, sir, for your inspiring word of wisdom. As a gesture of our deepest gratitude and appreciation, I would now request Dr. Sudarshan Ballal sir to kindly present a memento to his brother, Dr. H.S. Ballal, as a token of love and respect for his invaluable contribution. Thank you, sirs. Ralph Waldo Emerson once said, "Cultivate the habit of being grateful for every good thing that comes to you and to give thanks continually. And because all things have contributed to your advancement, you should include all things in your gratitude." I call upon Dr. Sushanth B., Assistant Professor, Department of Nephrology, KMC Mangalore, to propose the vote of thanks.
Good evening to all. On behalf of Department of Nephrology, it is my privilege to deliver the vote of thanks on this special occasion. First and foremost, I extend our heartfelt gratitude to Dr. Sudarshan Ballal, Chairman, MHEPL, for sharing his valuable insights with us. Sir, your presence has added immense value to this event, and we couldn't have asked for a more inspiring individual to grace this occasion. I also express my sincere thanks to our esteemed speaker, Professor Vivekanand Jha, Executive Director, George Institute of India. Your thought-provoking presentation truly befitting the grandeur of today's event. A special note of thanks to Dr. H.S. Ballal, Honorable Pro-Chancellor, MAHE, for the unwavering support, and thank you, sir, for presiding over this function and enriching us with your presence. On behalf of the organizing committee, I would express my deep gratitude to our chief guest, Dr. M.D. Venkatesh, Honorable Vice Chancellor, MAHE, for making time to join us despite of your busy schedule. Your enthusiasm and words have made this event all the more impactful. Our heartfelt thanks to the distinguished guests of honor, Dr. Sharath Rao, Pro Vice Chancellor MAHE, Dr. Vijayakumar, Honorable Vice Chancellor, Yenepoya deemed to be University, Dr. Dilip G Naik, Pro Vice Chancellor MAHE, Mangalore Campus, and Dr. Padmaraj Hegde, Dean KMC Manipal, for gracing us with the presence and lending prestige to this occasion. I also take this opportunity to express our gratitude to our leader, Dr. Unnikrishnan, Dean KMC Mangalore, for joining us and contributing for the success of this event. A special thanks to Dr. Ashita Uppur, Dean MCOTS Mangalore, for her support and encouragement. A sincere thanks to you, Mr. Sagir Siddiqui, Regional COO, KMC Hospitals, for your unwavering support in ensuring the smooth conduct of this program. We are also grateful to the medical superintendents of our hospitals across the district, Dr. Chakrapani, Dr. Kirtinath Ballal, Dr. Avinash Shetty, and Dr. Shivanand Prabhu. Your support and presence are deeply appreciated. To all the associate deans, head of departments, faculty members of KMC, consultants and postgraduates who have joined us today, thank you for your participation and engagement. A heartfelt thank you to all the nephrologists from Mangalore and across the country who have accepted our invitation and actively contributed in making this event a truly memorable one. Our sincere gratitude extends to MHEPL and Dr. Reddy Labs for their generous contribution in ensuring the success of this program. A special thanks to Ocean Pearl for the delicious food that has added a delightful touch to the evening. Last but not the least, I extend my gratitude to the administrative staff, the marketing and the operation team of KMC Hospital, especially Rakesh, Dhruv, Dr. Sindhu, Sandhya and Nirmala for their seamless logistical efforts. Finally, our MC of the evening, Mrs. Aruna Malya, deserves special thanks for her excellent anchoring of this event. Thank you everyone for making this occasion a remarkable success. Good night.
Thank you, sir, for those kind words. May this oration named after Dr. Ballal continue to uphold the values and standards that he represents in the world of medicine. Let us carry forward the values and ideas that this oration represents and continue striving for excellence in all we do. Thank you all. Have a wonderful evening. Please join us for dinner.